Ankle sprains are an injury that can occur to the average person, whether they step on uneven ground or when it's snowy and icy, or it can happen to the weekend warrior or professional athlete. It's a very common injury that we as podiatrists encounter. Oftentimes when people injure their ankle, they think it's no big deal and they try to walk it off. Some people do rest, ice, compression, and elevation on their own. Others will go to an ER or a minute clinic or urgent care. Oftentimes, the treatment that they receive there is not optimal. It's not what I would do in my office. In my experience, going to one of those locations and having either an air cast or a simple ACE bandage applied is simply not enough. When you come to our office, we'll perform an x-ray to make sure that there are no fractures, either in the ankle or in the foot, and we do a full examination to evaluate the ligaments and tendons about the ankle. Oftentimes, depending on the severity of the ankle sprain, immobilization is a must. You simply have to be put in either an ambulatory cast, which you can walk on, or into a cam walker, which is also a big boot that you can walk in. After a week or so, depending on how the patient does, we can progress you into an ankle brace, which is laced up and has a figure of 8 configuration for maximum support and stability. If the ankle sprain is severe enough, an MRI may be warranted. If the MRI shows tearing of the ligaments or any tears in the tendons, sometimes surgery is a necessity. Often though, we can get people better with conservative care, whether it be through immobilization and bracing, or with a course of physical therapy, which can include balance training, also known as proprioception. Please come to our office today if you have any ankle injury, and we would be happy to help you and get you back to the activities that you love to do.